Welcome to the Aurora Blueprint, our bariatric podcast aimed at patients undergoing the bariatric surgical process. Today I'm joined by Dr. Eman Al-Naggar, who is a consultant obstetrician and gynecologist from her health clinic in Murdoch. Eman, thank you for joining us today.
Thank you for inviting me, Ruth.
I wanted to do a deep dive into pregnancy and bariatric surgery. I think we have a very common cohort of patients. For myself, 90% of my patients are women, 65% are women of childbearing age. So thinking about their childbearing journey, fertility and pregnancy is a key aspect of what we discuss. And I think for yourself, that would come up a lot as well. So just to start off with, is it safe to undergo bariatric surgery for patients who are thinking about getting pregnant?
Yes, absolutely. It's safe and it can be very helpful as well for women who have issues with fertility, who can't fall pregnant because of extra weight. And having bariatric surgery can help them, become more fertile and achieve their goal of having a family.
And does it matter whether they've had a sleeve or a bypass?
Yes, it does matter. As you are aware, Ruth, like a sleeve, it just restricts the amount of food, whereas a bypasses the stomach. Am I right to frame it like that?
Yeah.
So the nutritional vitamin deficiencies are more common in women who've had a bypass. When I get a referral for a pregnant woman, when I look at what kind of weight loss they've had, the first question in my head is it a sleeve or is it a bypass? I do know that women who have bypasses have more complications if they're pregnant really early on after a bypass and haven't waited the recommended 12 to 18 months. And one of the things that I've seen a few times is small bowel obstruction. When their babies get bigger, fill up their pelvis and up into the abdomen, they cause a lot of pressure on the stomach. We know just women who haven't had surgery will suffer from things related to the gut because progesterone, which is the predominant hormone in the pregnancy, relaxes everything to allow the baby to grow. Same time, decreases the gut motility, and in the same way, they have more reflux. And it's the same thing with women who've had a bypass, then everything relaxes and they have more presentations to emergency with acute upper abdominal pain, which then turns out to be small bowel obstruction. And very rarely I have seen women who have had to have more surgery. The other thing that can happen if they fall pregnant really quickly after having weight loss surgery is we know that women who have rapid weight loss will then have gallstones and then end up having removal of their gallbladder. And that can be very tricky in pregnancy. And women who haven't had weight loss surgery and still have gallstones, we can tend to help them not have surgery because it's not as acute, it's not as quick, it's a chronic thing. So that can be quite tricky to happen throughout pregnancy.
I'm so glad to hear you say that because that's very similar to what I say to my patients as well, that for a woman that hasn't completed their childbearing journey, we try very hard not to do a bypass because of the added risks involved. In straightforward terms, with a sleeve, I've only stapled the stomach, and the stomach is so far away from the uterus, even when it grows to its maximal size at 40 plus weeks, it's still nowhere near the stomach. Whereas, like you mentioned, you've got other risks involved. If I've done a bypass and I've fiddled with the small bowel, and you get added risks of adhesions and internal hernias and things, and it's especially hard because it's a lot of those things you can only diagnose with a CT scan, and we can't CAT scan them because they're pregnant. And so it becomes a very difficult diagnostic process, whereas for my patients who have had sleeves, they are very well monitored, and so we do tend to keep them on the multivitamins and keep a close eye on their bloods at 3, 6, 12 months and every 12 months beyond. But even for those that haven't gone through our clinic, who haven't done that, they tend to do very well after a sleeve. It's the sleeve ones do well. The bypasses, we need to be extraordinarily careful about choosing those patients if we are going to do a bypass for a patient who hasn't completed their childbearing journey. So tell me, what are the benefits of having undertaken weight loss surgery from a fertility perspective?
Women who lose weight and have underlying polycystic ovarian syndrome have their cycles regulate, because evidence has suggested that weight loss of 5 to 10% can help regulate your periods again. And that means you're ovulating and ready to have a baby.
And to follow on from that, what are the benefits of having had weight loss surgery before pregnancy?
If you've stabilized your weight and you fall pregnant after weight stability, there's lots of advantages. There was a really excellent study done quite a few years ago, and it looked at pregnancy outcomes and improved outcomes. The biggest outcome that we noticed is actually having a normal vaginal delivery. We do know that women who are bigger, and just depending on their BMI and what the BMI is, or they have a higher risk of what we call obstruction in labor, and then ending up with a cesarean section, which is another, it's a major abdominal surgery. Obviously, if women elect to do that, that's fine. But if they don't want to and they're trying to have a normal birth, having weight loss surgery can help them achieve that. It also, the biggest improvement is the diagnosis of gestational diabetes. It is, being on the bigger side, is a risk factor to having gestational diabetes. Not just that, but just one of the big causes of having gestational diabetes. So once they achieve weight loss, although we cannot do what we call the glucose tolerance test because of their surgery, but we can monitor the blood sugars, and we have seen that it actually has improved blood sugar levels and decreases large for gestational age babies. In just easy language, less bigger babies, which then means easier vaginal deliveries, as well as preeclampsia and hypertension. These are also quite risky for women who are pregnant, and it has shown a significant decrease in pregnancy-induced hypertension and preeclampsia.
Okay. Are there unique risks involved with having had bariatric surgery prior to a pregnancy?
As we were talking about earlier, the biggest thing is nutritional deficiencies, but in women who've had a bypass surgery, it's the small bowel obstruction that they tend to have as their uterus is growing and pushing up on their bowel. So lots of reflux. We have reflux anyway when we're pregnant, and a lot more severe when they've had weight loss surgery.
And a lot of women will ask, will the growing fetus or the baby miss out on nutrition as a result of having had the surgery?
If they're well managed and, physicians talk to each other and collaborate and tests are being done and supplements are being taken, the chances of the baby being affected is very, very low. Only in women who miss out on care that can happen. More commonly with bypass surgery, not sleeve. So healthy pregnancy, very achievable after weight loss surgery. Actually, it's the most common thing we see is women have weight loss surgery, and they have very healthy pregnancies and very good outcomes.
And in terms of the multivitamins, we always put them on a multivitamin, and I know there are different ones that you encourage as well. Is there a difference in the way they should take it, or which ones they should take in the lead up to pregnancy and during the pregnancy itself?
Not really. I think just being supplemented appropriately is what really matters. In a woman who hasn't had weight loss surgery, we talk about folic acid, vitamin D, the big ones, and iron, because your fetus is growing and needs iron to create blood and bone. So calcium as well, it has shown to become more and more important in women who are trying to fall pregnant. Now, after weight loss surgery, I think vitamin B12 would be the big one to talk about. Generally, I don't advise a specific supplement. I just look at the doses, make sure that women are supplemented appropriately, and do blood tests to check levels.
That's fantastic advice. Okay, and finally, do you have any top tips for patients who might be considering pregnancy after bariatric surgery, we'll say after a sleeve gastrectomy?
Being patient and making sure that contraception is not a pill. A very important thing, I think, that we don't talk about enough, especially immediately in that post-operative period when stomach is healing and the gut is healing. A Kylina or a Mirena, make sure it's inserted prior to, or an injection, like a Depo-Provera, which is 3 months, to make sure that they do not fall pregnant. And if women are, sure that using condoms for them, as long as they know that, if it's used properly, the chances of falling pregnant on condoms is as low as other contraceptives. But, these are the important tips. Wait the 12 months, then engage with your GP and your surgeon. Make sure that your vitamins are normal. Make sure that you are on folic acid. Folic acid is extremely important for the 3 months prior to conception.
And that's high dose folic acid?
Well, a high dose folic acid is recommended for women who have higher BMIs. So that will then marry with, women who've had weight loss surgery.
Fantastic. Thank you very much for your time, Eman. I'm really grateful for that. And I hope that's answered a lot of the questions that we've been getting.
Thanks, Ruth.